Addressing disparities and implementing best practices for HIV prevention in vulnerable populations requires a multifaceted approach. Here are 10 strategies to promote equitable access to prevention measures. Tailored outreach programs. Develop targeted outreach programs that specifically address the unique needs, cultural nuances, and challenges faced by vulnerable populations. This may involve community-based initiatives, mobile clinics, or partnerships with local organizations. Culturally competent education campaigns. Implement culturally competent education campaigns that resonate with the diverse backgrounds of vulnerable populations. Ensure that messages are delivered in languages spoken within the community and consider cultural sensitivities. Accessible testing and counseling services. Establish easily accessible and stigma-free HIV testing and counseling services within the communities. This can include mobile testing units, community centers, and partnerships with local healthcare providers. Community-based testing events. Organize community-based testing events to reach individuals who may face barriers to traditional healthcare settings. These events can provide a comfortable and familiar environment for testing and education. Distribution of prevention resources. Ensure a desperate distribution of prevention resources such as condoms, lubricants, and educational materials. Collaborate with community leaders and organizations to make these resources readily available. PrEP access programs. Implement programs to increase access to pre-exposure prophylaxis PrEP among vulnerable populations. This may involve financial assistance, awareness campaigns, and partnerships with healthcare providers. Peer-led support groups. Establish peer-led support groups within vulnerable communities to create a safe space for individuals to share experiences, ask questions, and receive support. Peer advocates can play a crucial role in disseminating prevention information. Mental health support services. Recognize and address the mental health challenges faced by vulnerable populations. Provide mental health support services, including counseling and resources, to address the intersection of mental health and HIV prevention. Policy advocacy for inclusivity. Advocate for policies that promote inclusivity and address social determinants of health, such as housing and employment disparities. Engage with policymakers to ensure that prevention efforts are inclusive and reach all communities. Data collection and research. Conduct research and collect data on HIV prevalence and prevention needs within vulnerable populations. Use this information to tailor interventions, allocate resources effectively, and continuously adapt strategies based on evolving community needs.